Okay, welcome ladies and gentlemen. This is Jock here from Holistic Therapies Directory, and now we have with us a good friend and holistic doctor, therapist and marketer and entrepreneurial spirit all rolled into one. This is Justin Mandel. Justin, welcome. How are you?
Thanks so much, Jock. Great to be here. Thanks for having me. I'm looking forward to sharing with your audience.
Awesome, awesome. Now, Justin, tell me, how did you become a holistic doctor? What got you so interested in this life or in this work?
Good question. When I was in college, I started to take a Tai Chi class. And eventually, after enough time, I started to feel some of that chi, some of that energy flowing in me for the very first time. And I was actually interning with a Chinese doctor from Shanghai, and it just sort of connected where basically I ended up understanding that acupuncture was the quick way, if you will, to unblock these blockages of chi, energy, life force that's flowing through the body. So that's how it all came together for me.
And did you actually suffer from anything, particularly yourself? Because I notice when I speak to a lot of other holistic therapists or holistic doctors, they tend to come round to this side of thinking because they've experienced something that Western medicine hasn't quite caught up with.
Not in my case. I was a very young, strapping young man. I had no health problems. But what was great, and I still, memories that I still have, very vivid memories of being with Dr. Tu and talking with the male patients that I got to see with him. And I remember them telling me that, acupuncture is getting me better, and all of this other stuff that my medical doctor is doing with me isn't helping.
And obviously that's then taking you forward. You got so interested in it, you actually went and trained and became a holistic doctor.
I did. It's been a long journey. 1997 was my 20th year anniversary since first interning with him. So it's definitely been quite some time.
And from that, you've obviously learned so many modalities. You've seen thousands of patients, and this has culminated into some new techniques and new things that you've developed to help people. Tell us a little bit about
that. Sure. Well, before we even get into that, let me just say I've personally experienced so many different types of healing therapies myself.
Wow.
And that has really sort of opened my eyes as to what's out there. And it's everything sort of that's varying from, some real physical sort of manipulation, like Rolfing, all the way into some really high frequency sort of energy work. So I really have a very wide breadth of experience. I've invested tens and tens of thousands of dollars on my own healing by going with these, to these different therapists for different things along the way. So that's really been eye-opening. And, sitting here before you, 20 years after first starting with Dr. Tu, I never would have imagined that I would have created really a couple of things that has the capacity to be able to help ultimately millions of patients from around the world.
So do you think it's something that you took more towards one particular modality and expanded on it and created, where there used to be a chasm and massive diversion, you've kind of shut that down and created a bridge?
I think what it comes down to as a clinician, what you're always striving for, if you're trying to improve yourself as a practitioner, if you're trying to improve your practice, if you're trying to improve your patients' lives, what you're always doing is you're always striving to see, what is working best for my patients. And as a result, with enough time and after seeing, treating, examining thousands and thousands of patients, then, eventually you get enough clinical experience where you're able to sort of eventually say, like, hey, this thing, whatever it may be, is really working for my patients. And you're getting the feedback from them. And of course, you're doing your own work. You're getting, you're creating your own objective, analysis. You're getting those results. You're mating that together with your patient's subjective, feelings about how much they've improved and whatnot based on their symptoms getting better. So it's really sort of like an introspection process, if you will. And you're trying to sort of, you're just trying to figure out what is making a really deep impact on patients' lives.
And so this has helped you obviously develop. I now know that you've developed your own modality. It's having tremendous success. And tell us a little bit about that and where is it going and how have you came across this?
Sure. Well, before we get into the Trapeaze Technique, which is a healing therapy modality for upper back pain, specifically for the upper trapezius muscle, really my experience as an inventor, if you will, actually started way before that. And, as a holistic practitioner, I would have patients, they would check off, all of their issues when they first came in on their patient forms. And I had, about 10% of Americans around suffer from a urinary condition called overactive bladder. And so this was really the first condition where a lightning bolt ended up hitting me. And I eventually realized, like, hey, you really have something unique here that has the capacity to benefit so many patients. So that was really the first thing. That's the bladder re-expansion technique. That's a patented technique. It's the first procedure that's ever been invented. No urologist, even to this day, has come up with anything like this. And it's basically two things in one. It's a treatment together with a piece of patented equipment. And to this day, Harvard, Johns Hopkins, many of the top urology hospitals from across the United States has seen my work, and Harvard actually called it intriguing. So that's really,
that's amazing.
It is. It's going to be so great to see once we run the clinical trial, what are the actual results going to be? And then from there, let's sort of already get this out there, into the marketplace and start helping thousands, tens of thousands, hundreds of thousands of patients.
So your entrepreneurial spirit is basically being around changing people's lives.
Yeah, that's exactly it. I can't say it any better myself.
That's awesome. And obviously you're continually evolving. You have the urology technique. Now you have the Trapeaze technique as well.
Yep.
Which you're going to talk to us about in a moment.
Exactly.
And every one of them seem to have so much holistic energy behind it. It's all natural. Tell us a little bit about your trapeze.
It's all natural. It's non-invasive.
Wow.
No medication, no drugs, no side effects really. So that also is going to be, fantastic to really see other practitioners start to use this to benefit their own patients, in their local areas. So the Trapeaze Technique, again, this is really the first treatment out there. When you go into different practitioners' offices, there's lots of different healing modalities out there.
Yeah, tons.
But until now, there's no specific upper back pain treatment for the upper trapezius, and that's what makes this so special. This isn't, let's say, a procedure like gua sha, which is a Chinese technique, basically with some practitioners use a spoon. There are tools out there specifically on the market to do this technique. So it's not like I took, let's say, gua sha and I basically made some changes to it, and like, hey, we have our own new technique. So this has been worked on for over a decade. I have, after all of this time, I've finally perfected it. And even now, I'm always trying to innovate. I'm always trying to sort of improve what's already been improved. And it'll be really great to have new practitioners come in, start to use this with their patients, with their massage clients, and see like, hey, let's take Dr. Justin's Trapeaze technique.
Yeah.
Let's do some of our own innovation. Let's try to sort of make it our own a little bit, and let's try to improve on it. So I think that that's going to just be a lot of fun for me to see.
Would you say then, Justin, that most of the people who are going to utilize the Trapeaze technique would be massage therapists, or is there other clinicians or other holistic therapists that would use this modality?
I think that pretty much if we're really going to sort of get laser focused, well, first of all, let me back out before I do that. The Trapeaze technique, it's for any licensed healthcare practitioner. Okay.
Right. Okay.
And pretty much what we're talking about chiropractors. We're talking about massage therapists. We're talking about physical therapists. We're talking about acupuncturists. We're talking about naturopaths. So those 5 types of practitioners, those are the types of licensed practitioners that's really going to be able to benefit the most from it. That being said, I believe from what I've seen already, the 2 types of practitioners that have the most direct interest in it are massage therapists and chiropractors.
Yeah, I was going to say that they seem to be your 2 main focal points.
Yes.
And how do they come to you and they learn this, or do you go to their workplace and teach it, or do you have online, or is it both? How do you do it? How do you bring them into it?
That's a good question. So right now, the way that it's set up, this is going to be 100% online. We're waiting to get the first group of practitioners in. We're going to get some feedback. If practitioners at that point, if they want, let's say, a quick 1-day boot camp to get, hands-on experience, we can totally do that. Otherwise, what's going to happen is there is the option for me to actually go to a practitioner's office, train them one-on-one, basically give them the experience right at their location. They don't have to go anywhere. And then I think down the line, what's going to end up happening is this is going to be a 2-day seminar.
Right. Can you tell us a little bit about, we're talking about the Trapeaze technique and your innovation from everything you've been involved with before, but what kind of results can we expect from our practitioners actually learning this and taking it to their patients?
Tremendous results is what it comes down to, because really what it is, you have to know what to do. And the Trapeaze technique, after all of this time, I've been able to methodically boil it down into 4 simple steps. So as long as you know what those 4 simple steps are, you already have experience with, having hands-on experience, touching patients, analyzing, what's happening with their bodies, then you're going to be able to apply it. And, I've seen patients benefit, really every single day that I do this. It's extremely impressive. So, really, if any of your patients, your massage clients, if they have chronic upper back pain and they've tried everything, then as long as you know what those 4 simple steps of the Trapeaze technique are, then it's highly likely that you're going to be able to deeply improve their life.
And I think that's a very important aspect of it, because there's so many people who have back pain in the US, and I want to say not just the US, Justin, but throughout the world, that a lot of the times when you go to the doctors or you go to see, there's so much that chiropractors can do, but when it's upper back pain, It's kind of live with it, lose weight, get better, stretch a little bit. There doesn't seem to be anything that's particularly targeting this area for people. So this is going to be an amazing benefit to people who are suffering.
Yeah, that's exactly right. Again, up until now, all of the treatments that have been used for upper back pain have been non-specific. So you're basically taking something that can be applied anywhere else on the body, and you're applying it to upper back pain. And with the trapeze technique, this is the first time where that doesn't need to happen anymore. And, I just see so many patients that are getting multiple types of therapy. They're getting acupuncture, they're getting massage therapy, they're getting chiropractic care, they're getting physical therapy. And until the trapeze technique, and these are the patients that I'm seeing right now, these are all car accident victims.
Wow.
Okay.
Yeah.
So, we're talking about, like, for example, I took a look at a patient's photo the other day. He was rear-ended, and the car that hit him was doing 60 miles an hour. Okay. The entire back of his car was completely demolished. So, it's very difficult to go ahead with somebody, let's say, like him, and apply all of the usual suspects and be able to get results. You need something that's going to target what I call our F-bombs, okay? F-bombs are fibrous bundles of muscle. And what's happening in an accident situation, in a trip and fall, after years of, let's say, being hunched over at a computer, typing away at an office cubicle, holding, a lot of people, they don't have a lot of body awareness, body consciousness. So you have a lot of people, I'm going to grab my iPhone over here. You have a lot of people that are craning their neck, looking at their iPhone, and medical doctors now are calling that text neck. Okay. And you take
you're making me, the way you're talking, I find myself going, right, I sit up, I'm just, it's like I'm at school, I want to get it right. And I'm starting to push myself, because we all do it. I think,
Absolutely.
I do it. We all do it.
We all do it, exactly. And the majority of people out there, let's be honest, they don't have that body awareness, because a lot of people, the majority of the public, they haven't done that introspective work, right? They haven't worked on their body, to any sense of length of time whatsoever. Maybe they go to the gym a little bit, probably not. This is America, let's face it. But that being said, working on upper backs, is a challenge. And with all of these problems, sitting poorly, being hunched over, neck, looking at your phone, I'm just glad that this treatment is out there, because it's really just going to be able to help so many people.
You are actually closing the gap where there was a massive divide, and you're closing that gap, and that's amazing. Well, listen, I mean, how can practitioners then get in touch with you and learn about this? If chiropractors want to do this, if massage therapists want to get certified and qualified in the trapeze technique, what's their next steps?
Very simple. Go to the Trapeaze Technique website, Trapeaze technique.com. There's a lot of information on the site. Take a look. There's about a 5-minute video. Watch the video. You're going to have a lot of information presented to you on the video. And then at the bottom of the website, sign up. Give your phone number, give your email address. And when we're ready to really show this for the first time very early on in 2018, I know I'm going to drop a nuclear bomb on people. Okay. I am.
That's a good analogy, Justin.
And I just want to say why. Most practitioners, and again, I've been involved in this for 20 years. I have 15 years of taking continuing education classes.
Yeah.
And the problem with most continuing education classes is that once you're finished with it, once you complete it, you don't have the ability to be able to successfully market it, okay? And that's part of the nuclear bomb that's going to get dropped, because for the very first time, with an upper back pain modality at least, you're going to have a complete marketing system, and you're going to need to see it to believe it.
That's awesome. I can hear the dog in the background, and I'm thinking, oh my God, what a time in an interview to start barking. But I mean, and here, and you hit the nail on the head. This is also a way of practices taking themselves to a new level and offering something that has not been done before, which increases their business, which increases their bottom line, which gets them as an authority in the marketplace. And that surely is probably one of the best things that you can offer.
You summed it up really, really well. And there's actually even more benefits way beyond what you just mentioned. So if you have upper back pain patients, upper back pain clients, if you have patients and clients where you've worked on them before and you haven't been able to get the results that they need, then I would really implore you at least go to the TrapeazeTechnique.com website and check it out.
That's awesome. Justin, I want to thank you for sharing your knowledge and your wisdom. And I think I'm excited to see how this develops, and I'm excited to bring this to our members. And for those who are not members of HTD, this you'll be able to watch this on different platforms, but you don't have to be a member to get in touch with you and do this. But certainly this is definitely a way to change the industry, as you say. You're going to be taking something and just making a difference in people's lives, a difference in people's practices. And I think that's awesome. It's fantastic. Is there anything else that you would want to say to people before we finish off this interview that might be important for them?
I think what it comes down to, I think it's very simple. You're here as a licensed healthcare practitioner to change lives. And there's no go-to resource up until now for upper back pain. So I would just really deeply implore you to take a look at everything that's being offered with the Trapeaze technique. And, I already know from some people who have inside access to what they've seen, and they've been totally blown away. I actually have somebody who was paying $1,000 a month for a treatment system that he could offer exclusively in his local area. And he took a look at everything that the Trapeaze technique has to offer. And he said, what's being offered is way beyond what I had when I was paying that $1,000 a month. And it's not going to cost anything even close to that.
I think that's important, because everybody is always worried about what it's going to cost. And they've also got to look at what are the benefits as opposed to what they invest in. They're making an investment in themselves and in their practice. And I'm going to put you on the spot. Will you give our HTD members a discounted rate? Or
I'll tell you something. At this point in time, things are so early on that whether you're an HTD member or maybe you're not a member and you're catching this video, everybody's going to be able to benefit the same. Okay, so
that's awesome.
Yeah, exactly. It's really going to be terrific. I can't wait to see all of the patient-client testimonials that everybody out there that's going to start to offer the Trapeaze technique are going to get. I mean, it's really just going to explode, and that's because it is so ultra effective. So
get in now before it's too late. That's the big thing. And what I'm looking forward to as well is I'm going to keep a close eye on this. I mean, you and I know each other fairly well. We're going to be promoting the testimonials and the case studies that we're going to put out there as well. We'll put in our magazine and put in HTD. I think it's awesome, and it's so exciting to see something new that's coming on the market. But it's not something that's regurgitated. it is actually new and it is beneficial. So I take my hat and I tip my hat to Justin, and I can't wait to see what happens. And thank you so much for spending the time with everyone here that's listening. And you'll be hearing a lot more from Justin. And if you want to chat with him as well, you can chat with him on our Facebook marketing group. You just need to go to the website and go on there. But I would implore you to please go to the trapeazetechnique.com or trapeazetechnique.com and check out this amazing new modality for upper back pain. Justin, thank you once again, and God bless.
Thank you so much, Jock. See you soon.
God bless, my friend.